Hi there, my name is Anand. I am a practicing board-certified psychiatrist who works in the Northern Virginia area in the suburbs of Washington, D.C. I work both as an inpatient psychiatrist and as an outpatient psychiatrist, so I guess you can think of me as a real doctor who works in the real world with real patients and who prescribes every day. This is what I do every day. So I guess I'm bringing that unique perspective because I felt like that was kind of missing from my foray into the internet and Google and even YouTube, because it lacked practicality. Either they were boring lectures or they were misconceptions and myths spread by people who don't really have the proper knowledge and understanding. So I guess I just offered myself out there for you as a resource. Now, I can't call this medical advice. I can certainly regard this as educational, informative, and even entertaining. But if this helps enrichen the discussion between you and your individualized provider, be they a therapist, a psychiatrist, a psychologist, then I think I've done my job in that respect, because it'll be hopefully a richer discussion, a better discussion, a more in-depth discussion, and then you can make better choices about your next steps in your treatment. And you'll have hopefully a deeper understanding of what you're going through, and be able to dispel others' myths and misconceptions in your own journey with life and others. So this is the first of many episodes I'm going to publish on this channel. I intend to look at the anxiety disorders, depressive disorders, bipolar disorder, schizophrenia, ADHD, you name it, whatever's in the DSM. I plan to basically look at in a very holistic and real way so that it can be of help to you. Because psychiatry and psychology and therapy are such a huge sphere of knowledge, I'm not going to break everything down into one 10-minute video. So what I want to do is break up, for example, the treatment of anxiety or the diagnosis of anxiety into a couple of videos, maybe 2 or 3 videos, just to give you a feel for how I look at it, how I treat it, and what's worked for me over the years. Same thing for depression and for psychotic disorders, and more importantly, how I distinguish between one and another. Why is something ADHD and not anxiety? Why is something schizophrenia and not bipolar disorder? And hopefully along the way, with your feedback, your support, I can provide other topics of interest to you as a resource, because we really need to dispel misinformation out there. We really need to educate properly. We need to empower people as to what therapy does, for example, and what medication does, and what therapy doesn't, and what medication doesn't do. So I'm hoping that you'll join me on this journey and support this channel, and I look forward to seeing you in the next few episodes. Thank you very much, and have a healthy day.